Most of the time, many regards patients with cancer or HIV as hopeless cases. They failed to see that in the plight of such adversity, physical rehabilitation play an important role in the well-being of patients with cancer or HIV. Rehabilitation helps in improving health, improving the quality of life, promoting independence, prevent the patient from getting worse or decreasing incidence of recurrence of condition, improving or maintaining the potential especially in physical, mental, social, and psychological aspects of the patient. Helps to restore self-esteem. Most of the time, when people get to know they have a cancer or HIV, their self-esteem usually decreases to the point that they do not want to interact anymore. They feel shy knowing what might other people say about them or their condition. Through exercise, patients regain their self-esteem and become confident again with themselves. And improve self-sufficiency. Alright then, let's repeat how rehabilitation helps the patient. 1. By improving health. 2. By improving the quality of life. 3. By promoting independence. 4. By preventing a patient's condition from getting worse. 5. By improving or maintaining the potential. 6. By restoring self-esteem, and lastly, 7. By improving self-sufficiency. I hope that makes clear to you that rehabilitation plays a part also in the treatment of patients with cancer or HIV. Time for a little reflection. Before we begin, I want you to answer this question. Now, as a physical therapist, how can you help a patient with cancer or HIV? I'll give you time to reflect on your answer. Good reflection. I want you to carry that thought as we go along on the discussion. Cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. Cancer affects everyone. The young and old, the rich and poor, men, women and children, and represents a tremendous burden on patients, families, and societies. Cancer is considered one of the leading causes of death in the world, particularly in the developing countries. Yet, many of these deaths can be avoided. Over 30% of cancer can be prevented by healthy lifestyle or by immunization against cancer-causing infections, HPV. Others can be detected early, treated and cured. Even with late-stage cancer, the suffering of patients can be relieved with good palliative care. The type of rehabilitative care that will be given will greatly depend on the needs of a patient. And these are as follows. Restorative. Patients are restored to functional health and allowing their return to duty or useful and productive life. It is like what has been lost will be regained. Supportive. It is designed to teach the patients to accommodate their disabilities and to minimize debilitating changes from an ongoing disease. Preventative. It tends to lessen the effect of expected disabilities and emphasize more of the patient education. So if a certain disease is detected, early actions should be done to counteract the impending complications. And palliative. The interventions and goals are focused on minimizing or eliminating complications and providing comfort and support. Pain control is an example. Okay. Let's recap that again. I want you to repeat as well for better retention. The types of rehabilitative care are restorative, supportive, preventative, and lastly palliative. What do you think are the benefits of exercise? Time to gather your thoughts. I know that question might be simple, but as a future physical therapist, you must know, what will be the role of exercise for these type of patients, or how does exercise make an impact in their condition? reduces fatigue. This is considered to be the number one complaint from cancer treatment. Fatigue. Cancer treatment results to a debilitating fatigue. This do not subside with increased sleep or improved nutrition. Through regular cardiovascular exercise, it decreases incidence of fatigue by improving endurance and also improving the energy levels. Exercise reduces incidence of nausea, vomiting and diarrhea. Nausea subsides within a few minutes of initiating aerobic exercise. But when nausea does not subside within the first few minutes of exercise, the attending physical therapist should postpone the exercise for at least 24 hours. Exercise improves functional capacity. Cancer patients treated with cardiotoxic agents, such as anthracyclines, can sustain a permanent cardiac damage that will affect physical performance. Patients treated with significant doses of these agents can have reduced exercise time, reduced maximal oxygen uptake, abnormal heart rate response, ST and T wave changes, and exercise-induced hypotension. A controlled study of patients undergoing aerobic exercise, supervised daily, supine bicycle ergometry, during treatment found multiple benefits in the exercise group, including less decrement in performance per treadmill testing, less pain, decreased duration of neutropenia, and shorter hospitalization. In a supervised program among breast cancer patients, it resulted to improved lean body mass, reduced body fat, and improved strength per submaximal muscle endurance protocol, which makes aerobic exercise an effective form to improve physical performance of patients with cancer. Exercise improves psychological functioning, and also, self-esteem. Exercise also helps in decreasing the risk of recurrence for some type of cancers, such as breast cancer and prostate cancer. Exercise decreases the risk for other chronic diseases, such as CVD, stroke, obesity, osteoporosis. Standard exercise testing methods are generally appropriate for patients with cancer who have been medically cleared for exercise. Such testing methods applicable are bicycle ergometer test and graded treadmill test. Exercise improves psychological functioning, and also, self-esteem. Also, the following considerations should also be kept in mind when prescribing exercise for cancer patients. Ideally, patients with cancer should receive a comprehensive assessment of all components of health-related physical fitness. However, this may create an unnecessary barrier to starting activity. For this reason, no assessments are required to start if a light-intensity walking, progressive strength training, or flexibility program has to be given. Be aware of the patient's health history, comorbid chronic diseases and health, and any exercise contraindications before commencing health-related fitness assessments or designing the exercise prescription. Understanding the most common toxicities associated with cancer treatments, including increased risk for fractures, cardiovascular events, and neuropathies related to specific types of treatment and musculoskeletal morbidities secondary to treatment, is very important. The appropriate fit recommendations will vary across the cancer experience and requires individualization of the exercise prescription. One should take note also that standard aerobic exercise is advisable for patients with Karnofsky 70% to 100% status. Frequency. The goal for aerobic exercise should be to increase gradually from the current physical activity level to 3 to 5 days per week, with resistance training of 2 to 3 days per week. Flexibility activities can occur daily, even during treatment. Evidence indicates even those currently undergoing systemic cancer treatments can increase daily physical activity sessions over the course of 1 month. Intensity. Alright then, let's repeat how rehabilitation helps the patient. 1. By improving health. 2. By improving the quality of life. 3. By promoting independence. 4. By preventing a patient's condition from getting worse. 5. By improving or maintaining the potential. 6. By restoring self-esteem, and lastly, 7. By improving self-sufficiency. I hope that aerobic exercise should be moderate, equivalent to RPE 12 to 13 or 40 to 60% of VO2R. Moderate intensity resistance exercise should be 60 to 70% of 1 RM or repetition maximum. Flexibility intensity should be mindful of ROM restrictions resulting to surgery and or radiation therapy. Time. Several short bouts per day rather than a single bout may be useful, particularly during active treatment. Aerobic exercise should be 75 minutes per week if vigorous intensity, or 150 minutes per week if moderate intensity, or an equivalent combination of two. The resistance training should be at least one set of 8 to 12 repetitions. Time. Aerobic exercise should be prolonged, rhythmic activities using large muscle groups, example are walking, cycling, swimming. Resistance exercise should be weights, resistance machines, or weight-bearing functional tasks, example, sit to stand, targeting all major muscle groups. Flexibility exercise should be stretching or ROM exercises of all major muscle groups, also addressing specific areas of joint or muscle restriction that may have resulted from treatment with steroids, radiation, or surgery. Slower progression may be needed among survivors of cancer compared to healthy adults. If exercise progression leads to an increase in fatigue or other common adverse symptoms as a result of prescribed exercise, the FIT principle of exercise prescription should be reduced to a level that is better tolerated. Up to 90% of all survivors of cancer will experience cancer-related fatigue at some point. Cancer-related fatigue is prevalent in patients receiving chemotherapy and radiation and may prevent or restrict the ability to exercise. Bone is a common site of metastases in many cancers, particularly breast, prostate, and lung cancer. Survivors with metastatic disease to the bone will require modification of their exercise program, example reduced impact, intensity, volume, given the increased risk of bone fragility and fractures. Cachexia or muscle wasting is prevalent in individuals with advanced gastrointestinal cancers and may limit exercise capacity, depending on the extent of muscle wasting. Identify when a patient or client is in an immune-suppressed state. There may be times when exercising at home or a medical setting would be more advisable than exercising in a public fitness facility. Swimming should not be prescribed for patients with indwelling catheters or central lines and feeding tubes, those with ostomies, those in an immune-suppressed state, or those receiving radiation. And improve self-sufficiency. Granulocyte count of less than 2,500 cells per cubic millimeters should take infection precautions. Platelet count of less than 50,000 cells per cubic millimeters should restrict any activity because of risk for bleeding. And hemoglobin of less than 10 grams per deciliter should stay away from any vigorous activity. HIV or human immunodeficiency virus is a sexual and blood-borne pathogen that infects, and in most persons, it gradually destroys a critical component of immunity, the helper-inducer lymphocytes, which is identified as the CD4 cells. The HIV attacks the CD4 cells that leads to its depletion. The normal CD4 count of a healthy individual is greater than 500. If HIV is left untreated, this will lead to the development of AIDS or acquired immunodeficiency syndrome. The illness interferes with the immune system, making people with AIDS much more likely to get infections, including opportunistic infections and tumors that do not affect people with working immune systems. And remember, human immunodeficiency virus causes AIDS. Acquired immunodeficiency syndrome is considered a secondary, or acquired, immunodeficiency since it does not result from a genetic or developmental defect. HIV can be transmitted by any contact of a mucous membrane or the bloodstream with an infected body fluid. Known routes are, through sexual contact, exposure to infected body fluids or tissues such as in open wounds, and from mother to fetus or child during the perinatal period.
Initiating System 1.
conditions associated with HIV infection suggest health benefits would be gained by regular participation in a program of combined aerobic and resistance exercise. The varied presentation of individuals with HIV requires a flexible approach. Further, data indicate individuals living with HIV adapt readily to exercise training, with some studies showing more robust responses than would be expected in a healthy population. Therefore, frequency. Exercise reduces type.
lecture. I hope I was able to help you to gain sufficient knowledge on this matter. Sooner or later you will become physical therapists, and I am pretty sure that once in your practice you will get to encounter patients with special conditions as these. Please do not forget what you have learned today. It may not be helpful to you at this moment, but when the time comes, this will make your rehabilitation much easier and lighter. For now, I have prepared a game for you. Check that out and see how you understand this lecture. Enjoy the game.